All right. So when you work on the legs, you can do part of this bilaterally, but just to make it easier, I'm going to do one leg at a time. So we're working primarily on the, in this position, the two surfaces we can access are the back of the thigh, which is more like the urinary bladder channel, and then also the hip and the side of the thigh, which is more the gallbladder channel. Okay, so start off, just like when you work on the back, it's good to start off just doing some rubbing, And I'm just keeping it really like longitudinal, following the shape of the leg. Okay, and then I like to just kind of follow that up with just palm pressing. So when you press, important thing is just to kind of get over your point of contact. Like my palm is the point of contact, so I'm just getting my body over this way. Don't put pressure directly on the back of the knee because that's, it's not stable. So you kind of skip over the knee. And when you work on the calf, just keep in mind that a lot of people have really tight calves, and any degree of pressure, they'll be like squirming or something. Okay. So if you do put pressure, just go gradually in, and then you can kind of sense if it's too much for the patient. They'll start tensing up. Okay. After you do the palm pressure, then you can do more specific point pressure and use more specific tools, whether you use your knuckles or as I like to do, my thumbs. Okay? This is good practice if you're trying to remember your points on the meridian, if you want to do that. But you can also just do a line on following the UV channel. So the UV channel basically runs up the posterior, runs down the posterior midline of the back of the leg. So if this is his leg right here, the middle and the lateral edge, you're going straight down the middle, starting from the gluteal fold right here. You're just going straight down, and even on the calf, it pretty much goes straight down the posterior midline of the calf. After the belly of the gastrocnemius, then it goes like just a little lateral, and it goes down this way. So whatever tool you want to use, whether it's your thumb. Okay, so this is like UB36, right in the middle of the gluteal fold. Okay. With the pressure, you can also add like some kneading. Okay, if you wanted to do like, this is a little harder in this position, but like the one finger meditation, you could do that. Okay, but any technique where you can add it to the pressing is fine. But we just progressively work our way down. If you want to, you can walk with your hands. So instead of just using my right hand, I could alternate, right and left hand. Sorry. And then, if you wanted to use other tools like your knuckles, you can do that as well. A lot of people have tension in the hamstrings, so be careful of that. But most people have tension in the calf, so you really have to be aware when you press down from the calf. Especially when you start getting close to like UV 57 area. Okay, so on the calf, you have the gastrocnemius. Okay, that has two bellies, one belly here and then one belly here. So the UV channel basically is going between the two bellies here. And then and then you'll get to, they call it the sulcus or whatever. It's the after these two bellies, there's like a point where it sort of, you fall into depression. That's where UB57 is. Okay. And from there you go lateral. And you go all the way to UB60, which is between the lateral malleolus and the Achilles tendon here. And usually you can stop there because the foot is done separately. Okay? So whatever specific tool you use, whether it's the thumb, you just kind of walk down the length of the UV channel. You can, if you want to, use more like penetration. Like I wouldn't use my elbow on the calf though. Okay, but you can use the elbow on part of the thigh. The thigh can take a fair amount of pressure. But after I do this more specific pressure going down, then I go into more of the grasping techniques. You can start off with relatively superficial grasping of the thigh. The good thing about grasping, especially for areas like the thigh, is that it gives you a better sense of, I guess, the three-dimensional nature of that part of the body. So you'll start to, better than if you were doing something like this to palpate, you'll start to feel what are the tight fibers, because they're gonna kind of stick out as you do this grasping. Okay, like I can feel, this right here is really tight. Okay, in this area, some of his hamstrings are tight. Okay, so in addition to just generally working on the tissue, you're using this to get a sense of where some of the tension is. Okay, and so if you feel something is tight, like this tight fiber right here from your grasping, then you can go back into more specific techniques like the pressing, okay, the kneading.
Nice to know that you're needed.
Oh no.
I just made that.
How do you feel to be needed? Pardon the pun.
But the main thing is you work on what, this is a little bit more free form. You just do the grasping to feel the general forms of the thigh, the tight muscles, and whatever you feel, you try to focus on. With more specific pressure. You can also, it's better if the thigh is exposed, but you can do some pushing over isolated areas. Like if the hard thing is that some of these will be like tight fibers, and whenever you do pushing, it's hard to push on a fiber because it's like you're walking a tightrope. Okay, but in very small increments, you can do kind of like a pushing technique along the fiber. But you try to be pretty extensive in your work. Like you can even work part of the medial aspect of the thigh in this position. Okay, and also the lateral aspect. Okay. Just try to find all of the the forms of the muscles in this whole area.